What if the first signs of Parkinson's weren't a tremor, but something much easier to miss? A frozen facial expression, a softer voice, a shuffling step. Would you notice? Would you know what it meant? Every year, thousands of families ignore the earliest clues, not out of neglect but because no one told them what to look for. Until it's too late. Parkinson's disease doesn't arrive like a storm. It creeps in quietly, slowly changing the way your loved one moves, speaks, and feels even before they realize it themselves. In this video, we're going to uncover the subtle, often missed signals that can appear years before diagnosis. We'll follow real-life stories, explore life-saving early interventions, and reveal the role you as a child, spouse, caregiver can play in changing the course of this disease. So stay with us. What you learn today could change the life of someone you love. Parkinson's disease affects nearly 10 million people worldwide, and while it's commonly linked to aging, few people understand how complex, emotional, and life-altering this condition truly is. It's not just about shaky hands. It's about losing balance physically and emotionally. It's about the frustration of not being able to button your shirt, the embarrassment of slurring your words, the fear of falling in public. And for families, it's about watching someone you love slowly disappear behind symptoms you can't explain or control. But here's what you need to know. The earlier you understand Parkinson's, the more power you have to help. In this episode, we'll begin with the science, what causes Parkinson's, and how it changes the brain. Then, we'll reveal the early warning signs most families miss, like changes in sleep, mood, handwriting, and even smell. We'll follow Robert, a retired teacher, whose daughter noticed something off long before his diagnosis and how that changed his future. We'll explore the latest treatments, including medication, physical therapy, assistive technology, and lifestyle adjustments that truly work. And we'll walk you through what it means to be a supportive family member without smothering, controlling, or losing yourself in the process. Whether you're already living with Parkinson's or you're simply worried about your aging parent, this video will equip you with clarity, compassion, and real-world tools to face what's ahead. Because when families understand Parkinson's early, they don't just help manage a disease, they preserve dignity, they protect independence, and they turn fear into strength. Most people believe Parkinson's is just a disease of tremors, but that's only part of the truth, and for many seniors, it's not even the first sign. Parkinson's disease is a progressive neurological disorder that affects the brain's ability to produce dopamine, a chemical that helps control movement, mood, and more. When dopamine levels drop, the body begins to lose control over basic motor functions, emotional regulation, and even automatic behaviors like blinking or swallowing. It's more common than you think. Nearly 1 in every 100 adults over age 60 will develop Parkinson's, and it doesn't affect everyone the same way. Imagine two people. Margaret, 67, begins to notice her hand trembles when she's holding her coffee. Robert, 72, isn't trembling, but he's taking smaller steps, speaking more softly, and struggling to show emotion on his face. Both are experiencing Parkinson's, but in very different forms. The disease progresses slowly. In the early stages, it may show up as stiffness in the arms or legs, often mistaken for arthritis. A subtle change in handwriting, called micrographia, where the letters become unusually small. Trouble swinging one arm while walking. A soft, hoarse voice or slurred speech. Facial masking where expressions fade and the person appears less animated. Sleep disturbances, fatigue, and mood changes, including depression or anxiety. Because these symptoms are gradual and varied, they're often dismissed as part of normal aging. But they're not. There are two main categories of symptoms in Parkinson's: motor and non-motor. Motor symptoms include tremors, muscle rigidity, bradykinesia, slowness of movement, and postural instability. These affect how someone walks, balances, uses their hands, or even gets out of a chair. Non-motor symptoms are often even more disabling. These can include constipation, loss of smell, anosmia, sleep behavior disorders, memory and thinking problems, emotional changes, including apathy and irritability. What makes Parkinson's so challenging is that no two journeys are the same. Some people may live for decades with manageable symptoms. Others may face rapid progression. That's why early understanding is critical, not just for seniors, but for the families around them. Because once you understand that Parkinson's is more than a tremor, you stop waiting for the obvious signs and start noticing the subtle shifts that truly matter. In the next segment, we'll help you recognize these early clues before they're too late to act on. Robert had always been a lively storyteller, the kind of grandfather who filled a room with warmth and laughter. But one holiday season, his daughter, Emily, noticed something had changed. His voice was softer. He smiled less. When he stood up from his chair, it took longer than usual. And during their walk after dinner, she noticed his left arm wasn't swinging. At first, she brushed it off. He's just getting older, she thought. But deep down, something didn't feel right. This is how Parkinson's often enters a family's life, not with alarms, but with whispers. Quiet, gradual shifts that are easy to miss if you don't know what to look for. Let's talk about those signs. 1. A change in facial expression, masked face. The person may look serious or blank, even when they're feeling fine. Their face becomes less animated, making it harder for others to read their emotions. Loved ones often say, "He doesn't look like himself anymore." 2. A softer or monotone voice. One of the earliest vocal changes in Parkinson's is hypophonia, a softening of voice volume and tone. It can make seniors seem withdrawn, even though they're trying to speak normally. 3. Changes in posture and walking. Watch for slouching, a forward-leaning posture, or a shuffling gait. The person may take smaller steps or struggle with balance. They might even fall more often without explanation. 4. Loss of arm swing. This might seem minor, but when one arm stops swinging naturally during walking, it's often one of the earliest motor signs. 5. Small, tight handwriting. Micrographia. Many families are surprised to learn that a sudden change in handwriting, smaller, cramped letters, can signal early Parkinson's. 6. Changes in sleep. Acting out dreams, sudden movements at night, insomnia, or increased daytime sleepiness can all be early signs, even before movement issues appear. 7. Mood and personality shifts. Some seniors become more irritable, withdrawn, or depressed. Others seem less motivated or emotionally flat. These changes are often dismissed as aging or fatigue, but they may be neurological. 8. Loss of smell. Anosmia. Strangely, a declining sense of smell can be one of the very first indicators, years before motor symptoms appear. If someone suddenly can't smell coffee, perfume, or their favorite foods, pay attention. What makes this so difficult is that none of these signs on their own scream Parkinson's. They can each be mistaken for other conditions or simply overlooked as part of growing older. But together, they form a picture, and it's families those closest to the person who are in the best position to see it. Here's what you can do. Observe gently but consistently. Write down patterns or changes over time. Ask open-ended questions. I've noticed your walk is different. Have you felt unbalanced lately? Avoid assumptions. Don't rush to conclusions, but don't dismiss your instincts either. Encourage a checkup. A neurologist can assess subtle signs with simple tests. Emily trusted her instinct. She scheduled an appointment for Robert, and while hearing the diagnosis was hard, catching it early gave him access to treatment, planning, and time. Time to adjust, to prepare, and to stay independent longer. You don't need to be a doctor to see the signs. You just need to look and care enough to act. There's one thing doctors, researchers, and patients all agree on. The earlier Parkinson's is diagnosed, the better the outcomes. But why does early diagnosis matter so much? First, let's understand how Parkinson's is identified. There's no single test, no blood work or imaging that definitively confirms it. Diagnosis is clinical. That means neurologists rely on observing physical signs, taking detailed medical histories, and sometimes using brain imaging to rule out other conditions. The process often begins with what you or a loved one notice. You described the slowness, the tremor, the stiffness. A neurologist observes how you walk, your balance, your facial expressions, and your reaction time. They may perform simple movement tests or use tools like the Unified Parkinson's Disease Rating Scale UPTRS. And here's where timing changes everything. 1. Early treatment means symptom control before they worsen. Medications like levodopa, dopamine agonists, and MAO-B inhibitors can help restore dopamine levels or mimic its effects. Starting treatment early doesn't cure Parkinson's, but it can preserve quality of life, mobility, and independence for much longer. 2. It opens the door to non-medication therapies. Physical therapy, speech therapy, occupational therapy all are most effective when started early. They help slow motor decline, prevent falls, and improve everyday function. 3. It helps prepare emotionally and logistically. A diagnosis gives families time to plan, adjusting the home for safety, planning for future care needs, exploring financial and legal options, seeking mental health support for both patient and caregiver. 4. It reduces the risk of misdiagnosis. Parkinson-like symptoms can sometimes be caused by other conditions, like essential tremor, multiple system atrophy, or normal pressure hydrocephalus. Early evaluation by a specialist helps avoid years of confusion and the wrong treatments. 5. It offers access to clinical trials and emerging treatments. Many clinical trials look specifically for patients in early stages. From gene therapies to neuroprotective drugs, being diagnosed early gives patients the chance to participate in cutting-edge science that may slow or modify the disease itself. Let's go back to Robert. When his daughter brought him to the neurologist, the signs were subtle but real. He was diagnosed with early-stage Parkinson's. Because it was caught early, he was able to begin a low-dose medication, enroll in a Parkinson-specific physical therapy program, and make small changes at home like installing grab bars in the bathroom and adjusting his daily routine. More importantly, he and his family had time to talk, to adjust, to set expectations, to face Parkinson's not with fear, but with a plan. Without that early action, Robert may have waited until a fall, until a hospital visit, until the disease had already taken more than it needed to. Parkinson's doesn't stop, but with early diagnosis, you can slow it down and stay one step ahead. When a loved one is diagnosed with Parkinson's, the family's role quietly transforms, often without warning. You're no longer just a son, daughter, spouse, or friend. You become a silent observer, an advocate, a daily support system. But here's the truth. Being there doesn't mean taking over. It means learning to walk beside them, not ahead, not behind. Let's talk about what that really looks like. 1. Emotional support is foundational. A Parkinson's diagnosis can be overwhelming. Fear, denial, even shame may arise, especially in the early stages. The person may feel like they're becoming a burden or losing their identity. You don't need all the answers, but listening, validating their feelings, and offering calm presence makes all the difference. 2. Respect their independencies. They move slower. Yes, tasks take longer, but avoid the temptation to rush in and do everything. Let them button the shirt, even if it takes time. Let them speak, even if their voice is quieter. Support isn't about efficiency, it's about dignity. 3. Create a safe and supportive home. Small changes make a big impact. Remove loose rugs to prevent falls. Install grab bars in bathrooms. Ensure good lighting in hallways and stairs. Simplify organization. Place frequently used items at easy reach. 4. Encourage routine and activity. Structure brings calm. Encourage daily walks, gentle exercise, cognitive games, or social interaction. Even a shared puzzle or regular phone call with a friend helps maintain emotional balance. 5. Learn the disease together. Parkinson's evolves. So should your knowledge. Read trusted resources, attend support groups, ask the neurologist questions. When families understand the condition, they can anticipate changes and adapt with less stress. 6. Practice patience with communication. Pausing can affect speech and facial expression. Let them finish their thoughts. Look beyond words. Tone, gestures, pauses, they all carry meaning. Communication takes more effort, but it also becomes more intentional, more human. 7. Care for the caregiver. This is vital and often forgotten. Caregivers are at high risk for burnout, anxiety, and depression. Make space for yourself. Ask for help, accept it, and don't wait until exhaustion forces a break. Let's revisit Emily and her father, Robert. She didn't try to be his nurse. She didn't hover. She made his environment safer, learned about his medications, and most of all, she treated him with the same respect and humor she always had. That gave Robert strength, and it gave her peace. Caring for someone with Parkinson's is not about perfection. It's about consistency, kindness, small choices that honor their autonomy while offering your presence day after day. In the next section, we'll dive into what treatments and therapies are available and how new technologies are making daily life with Parkinson's more manageable than ever. When it comes to Parkinson's, treatment is never one size fits all. It's a blend of science, routine, therapy, and adaptation. And today, more than ever, people with Parkinson's have options that go far beyond medication. Let's start with the most common foundation. 1. Medication. Restoring balance. The most widely used drug is levodopa, a compound that the brain converts into dopamine. It's often combined with carbidopa, which helps reduce side effects like nausea and allows more dopamine to reach the brain. Other medications include dopamine agonists, which mimic dopamine's effects, MAO-B inhibitors, which slow the breakdown of dopamine, COMT inhibitors, which prolong the action of levodopa. The goal isn't to cure but to manage symptoms effectively and help maintain daily functioning. Over time, medication regimens may need adjusting. That's why ongoing medical follow-up is essential. 2. Physical and occupational therapy. Movement and independencia movement disorder specialist may refer the patient to physical therapy to improve gait, balance, posture, and prevent falls. Occupational therapy to adapt daily tasks like dressing, eating, and using tools. Speech therapy SELP, especially if voice, swallowing, or articulation become difficult. Therapies are most effective when begun early and maintained regularly. 3. Assistive devices and home adaptation. Simple tools can make a major difference. Weighted utensils to reduce hand tremors. Shower chairs, raised toilet seats, and walkers. Smart pill dispensers that give reminders and dispense meds safely. Adaptive clothing with magnetic closures or easy zippers. 4. Technology. A growing Avenue tech is helping bridge the gap between symptom and support. Parkinson's-specific apps for tracking medication, mood, and mobility. Wearables that detect tremors or freezing episodes and give real-time feedback. Virtual reality and gamified rehab, used in therapy to improve coordination and engagement. In some cases, advanced treatments may be considered. 5. Deep brain stimulation DBS for certain patients, especially those with significant motor fluctuations. DBS may be recommended. It involves implanting electrodes in specific brain areas to regulate abnormal signals. While it doesn't cure Parkinson's, it can dramatically reduce tremors and improve movement in selected individuals. Let's return to Robert. 3 years after his diagnosis, Robert uses a voice amplification device at social events, tracks his medication with a smartwatch app, and attends a weekly Parkinson's exercise class. These tools don't erase the disease, but they give him control, confidence, and connection, things no medication alone could offer. Managing Parkinson's is about staying in motion physically, emotionally, and technologically. And with the right tools in place, every day becomes a chance not just to survive, but to adapt and thrive. Parkinson's doesn't follow a script. For some, the disease advances slowly. For others, it brings more rapid change. But one truth remains: planning and hope can and must walk side by side. Let's start with the big question families ask. What will the future look like? 1. Expect change, but not all at once. Parkinson's is progressive, but not predictable. Some people live 20+ years with manageable symptoms, especially with early diagnosis and active treatment. Others may experience faster decline. Planning ahead doesn't mean expecting the worst, it means preparing for possibilities. 2. Embrace proactive planning. Now is the time to talk openly, lovingly about long-term care preferences, financial planning and legal documents, health proxies and decision-making, housing adjustments, or future living arrangements. These conversations are hard, but they bring relief and clarity when decisions must be made. 3. Build a circle of care. No one should do this alone. Create a team: doctors, therapists, family, friends, spiritual counselors, neighbors. Connect with Parkinson's support groups in person or online where experiences are shared and strength multiplies. 4. Monitor cognitive and mental health in later stages. Parkinson's can affect memory, judgment, and mood. Stay vigilant for changes in memory recall, problem-solving, increased confusion or hallucination sprees, or apathy. Mental health support and involving neurologists and psychologists helps maintain dignity and quality of life. 5. Hope lives in science. There's no cure yet, but every year, clinical trials, research breakthroughs, and new therapies bring real hope. Gene therapies, targeted neuroprotection, stem cell implants, these aren't science fiction. They're happening right now. The Michael J. Fox Foundation alone has invested over $1.5 billion in Parkinson's research, fueling global efforts to understand, treat, and one day reverse this disease. 6. Hope lives in people. Stories like Robert's, who still teaches part-time online, in Margaret's, who joined a Parkinson's choir and found her voice again, in the caregivers who find meaning in presence, not perfection, in the families who, together, learn that life with Parkinson's is still life full of purpose, connection, and love. Planning isn't about surrender. It's about reclaiming control in the face of uncertainty. And hope? It's not naive. Hope is a strategy, one that fuels resilience, dignity, and strength, even in the most unpredictable moments. In our final message, we'll reflect on everything we've explored and the one thing every family needs to remember as they face Parkinson's together. Parkinson's changes lives. It challenges movement, speech, routines, and sometimes even relationships. But it does not erase a person. It does not steal their worth. It does not define their story. What defines it is how we respond. When a family learns to notice the early signs, they choose presence over delay. When a daughter schedules that first appointment. When a son installs grab bars without being asked. When a spouse chooses patience on the hard days and laughter on the good ones. That's where strength is born. Robert still tells stories just a little slower now. Margaret still sings a little softer, but with deeper meaning. And Emily? She says Parkinson's taught her how to listen with her eyes, not just her ears. So what about you? Maybe you've seen something in a loved one lately, something subtle, something easy to ignore. Maybe you've been too afraid to ask. Or maybe you're the one who's starting to notice changes in yourself. Whatever brought you here today, let this be your turning point. Talk, ask, observe, support, plan, hope. Because the earlier you understand Parkinson's, the more power you have not to control the disease, but to protect everything that still matters. Love, dignity, connection, choice. This is not the end. It's the beginning of knowing, adapting, and walking forward together.